Hello, my name is Emily Lieberman, and today I am going to be sharing a presentation on oral magnesium supplementation in the reduction of migraine symptoms. So in this presentation, we're going to be going over several objectives. So we're going to be starting with the background on migraines and also the background on oral magnesium supplementation. We're going to then go into introducing our research question, along with going into the methodology that was used with this research. We're going to go further with the discussion of each of the studies that were reviewed based on the research question in hand. We're then going to go into the synthesis and comparison of results across the various studies that we looked into. We're going to go into the conclusion and give an evidence grade based on the findings and the conclusion drawn from this research. We're going to end the presentation looking at the strengths and limitations. And finally, we're going to look at the implications for research and practice based on all the findings that we found based around the nutrition question that we're trying to answer today. So let's start at looking at the background of migraines. So a fun statistic, 1 in 4 households in the United States currently has a family member suffering from migraines. So this statistic alone can show how prevalent migraine is. 1 in 4 households, somebody in that household is currently suffering from migraines. So it shows also, looking on the left slide, migraine is the third most common type of disease worldwide, and it affects 1 out of 7 people globally each day, with an estimated 148 million people suffering from chronic migraines. So this really shows that migraine is a serious condition that affects so many people globally. So some symptoms that are related to migraines include nausea. You could have sensitivity to light and sound. You can also suffer from loss of vision, difficulty with speech, and you can also have intense pain that can be on one side of the head. It could also occur behind the eyes as well. So based around people that suffer from migraines, these are the most common symptoms that have been reported. So the common method for treatment of migraine disorder is usually a pain reliever that many of you may see over the counter, something like an Advil, a Motrin, or a Tylenol that will help with relieving the pain and the symptoms associated with migraines for a short period of time. So the problem is when you take these pain relievers too often, there can be adverse side effects that can occur. So some of these side effects from taking these pain relievers too often include the overuse of medication that relates with headaches. It can lead to ulcers, and it can also lead to bleeding in the GI tract. So that's a little bit of a background on migraines. Now looking into background of magnesium. So magnesium is a nutrient with the recommended dietary allowance of 400 to 420 milligrams daily for adults over the age of 19. So research has shown that magnesium can play an important role in preventing diseases that include diabetes, osteoporosis, migraine, and cardiovascular disease. So you can see the picture on the right. It kind of shows how magnesium can be used for different therapeutic uses. So we kind of discussed a little bit already with cardiovascular health. It helps with the sleep aid, stress and anxiety reduction. It can help with regulating blood sugar, muscle and bone health. And for the purposes of this presentation and this research, it can help with migraine relief. So this kind of shows how taking oral magnesium supplementation of 400 to 420 milligrams daily can lead to different various benefits within the body, from cardiovascular health to lowering our blood sugars, helping our muscles and bones. And we're going to discuss further how magnesium can ultimately help with migraine relief. So this leads into our research question. In middle-aged adults between the ages of 40 to 60 years of age, how does oral magnesium supplementation of 300 milligrams daily affect the reduction of migraine formation in this population within a 1-year time frame? So the methodology that's going to be used for this research is break down into 3 parts. So first, looking at the population. So participants between the ages of 40 and 60 will primarily be focused on. I chose to look into participants between the ages of 40 to 60 based on findings that this age group is more prevalent of having more severe migraine symptoms. And I also think that participants between these ages are more highly to be willing to participate throughout the duration of the study compared to someone that is younger who may be in school or maybe starting off in a working field. I think this population in general is a good age group to look at. Number two, looking at oral magnesium. So primarily oral magnesium will be used within the studies. Oral magnesium is the method that I believe is most accessible to the general population. It's the less cost effective when comparing to something like an IV magnesium. So oral magnesium will be primarily used within the studies. And the other criteria, research must be written in English for the purposes of understanding the findings and just comparing different researches that are in one language compared to research that is in different languages. And with the wording may be changed a little bit based on a different language. So criteria, research must be written in English primarily. So looking at the different studies found, different methods were used to find these studies. For example, PubMed and CBI was used. Criteria looked for with wording such as migraines, headaches, older adults, magnesium were plugged in when finding the research. So primarily four different research articles were looked at. We can see here, 1, 2, 3, 4 were looked at, and starting with the first one is a randomized controlled double-blind study that was found and done in Iran. This article, of course, was written in English, but was held in Iran for the purposes of the study. So this particular study compared magnesium sodium valtrate therapy with other forms of magnesium in terms of migraine prevention. So this study looked at different types of magnesium supplementation in the reduction of migraines. For the purposes of our study, we are focusing just on the oral magnesium aspect of the study that was found. So participants were between the ages of 18 and 65 and had to report at least 4 months of migraine attacks. Although this age group does not land exactly on our 40 to 60, as we discussed in our research question, this study gave us a good overview of in that age range of the 40 to 60, how these migraine symptoms would be reduced. So in this study, there was intervention groups that were made with group A receiving 200 milligrams of sodium valproate orally and also a placebo tablet. Group B received 250 milligrams of magnesium oxide orally, and then group C received 250 milligram magnesium oxide with a placebo tablet as well. So each group received an oral magnesium supplement, and they also received a placebo, which is a good way to look at how the magnesium would work compared to a placebo. So outcome and conclusions that were found in this first study basically show that sodium valproate and magnesium oral supplementation has shown to reduce migraine frequency. And it also looked to test the efficiency of each oral tablet. So based on the outcome data and the conclusions, we can conclude based on that study that oral magnesium supplementation can show reduction in migraine frequency. So the second article found is no study design information was available, but this is from the Pan-African Medical Journal, and this is an article that showed to compare the magnesium levels within those who suffer from migraines and those who do not suffer from migraines. So this gives a big insight on how magnesium levels may differ from those who have migraines and those who don't experience any symptoms of migraines. So it could give a better insight on how the magnesium levels are different between both groups. So they had 50 patients with reported migraines between the ages of 18 and 50 that were referred to the emergency ward for migraine attacks, and 50 healthy individuals without any reported migraine attacks or family history of migraines. And based on the study, blood samples were collected to compare magnesium levels, And then conclusions and results that were found from this study was those individuals who suffer from reported migraines are noted to have lower serum magnesium levels than those individuals who do not report any migraine symptoms. So this study showcases how those with migraine symptoms are already having that lower magnesium blood serum levels and how those that do not have any migraine symptoms have higher magnesium. So this ultimately can show that incorporating an oral magnesium supplement may be beneficial to raise those blood serum magnesium levels in those individuals that suffer from migraine symptoms. In our third study, we have a double-blinded randomized control study done in the United States that is comparing the use of magnesium through IV with other forms of therapy for migraine treatment. Again, we are focusing primarily on the oral magnesium aspect of this study, even though they also use an IV magnesium supplementation form. The study was done in a level 1 trauma medical center in Chicago with patients that are over the age of 18 with chief complaint of migraines or headaches. Again, not the particular age group of 40 to 60, but we still have adults over the age of 18, and we can also primarily focus on the 40 to 60 age range when looking at the study. So the patients were chosen for the study. They were giving magnesium to these patients through either IV from or prochlorperazine or metochlopramidine bromide. Sorry if I did not pronounce that correctly. Um, and then our outcome data shows and the conclusions that there was no statistically significant result between the three various methods in the study with changes in median pain score, but it did show that ultimately these magnesium supplementations can help with reducing the frequency of migraines, even though there's no real change in the pain scores. So ultimately, the study did not give as much information as the other studies, but it did showcase that magnesium, it does not really matter which method you choose. It could still reduce the pain level. It just one form of magnesium is not going to do more with reducing that pain level compared to other forms of magnesium. So that's something to keep in mind. There was no drastic changes within that. And then the last study that was found was a meta-analysis done in the Pain Physician Journal, which showcases the effects of both IV magnesium therapy and oral magnesium therapy on aiding with migraine attacks. Again, even though IV magnesium therapy is discussed and used, we are focusing primarily on the oral magnesium supplementation therapy. So in the study that was being analyzed, participants had to be age 17 or older with a diagnosis of migraines, and studies had to be published in either Chinese or English. Menstrual migraines and headaches were excluded. Participants in these studies were either given IV magnesium or were given oral magnesium supplementation through randomized controlled trials. Electronic databases were used to find these studies, including Embase and PubMed. So based on the outcome data and the conclusions, IV and oral magnesium have both shown to slow down the frequency and severity of migraines and can be used as methods of preventing migraines from occurring. So again, this showcases another research finding based on a big meta-analysis of various previous research, how oral magnesium supplementation can be ultimately utilized to showcase the slowdown of migraine symptoms in those that experience migraines. So that is an overview of the studies that were found based on this research. So looking at the bigger picture, again, our nutrition question in middle-aged adults between the ages of 40 to 60, how does oral magnesium supplementation of 300 milligrams daily affect the reduction in migraine formation in this population within a 1-year time frame? The interventions for this study providing 300 milligrams of oral magnesium supplementation daily compared to the placebo for a duration of 1 year to test the effectiveness in reducing symptoms of migraines and headaches in this population of individuals. So ultimately, one group can be given 300 milligrams oral magnesium daily. Another group can be given a placebo, similar to the other research that we found, where a group was given a magnesium and a placebo. In turn, interventions that could be made in a different study to look further into this research is giving one group the oral magnesium supplementation and one group a placebo to compare the different effects in each group with the symptoms of migraines. So ultimately, based on the research that was found and conducted, outcomes that would be found throughout the study is reduced migraine symptoms when taking oral magnesium supplementation daily, as well as a decrease in migraine formation when taking oral magnesium supplementation daily. Another research article was found with a quote showing how serum total magnesium levels was notably lower in the group with reported migraine attacks when compared to the control groups with no reported migraine attacks. So ultimately, when looking at the research and previous studies that were found and previous articles that were written, it could be shown how serum total magnesium levels are a lot lower in those with migraine symptoms. And it could be shown that when showing interventions to a group by having them take an oral magnesium supplementation daily and comparing that with a placebo, ultimately we would see results of higher serum magnesium levels once the oral magnesium supplementation is put into place, which would ultimately showcase reduction in those migraine symptoms and also the frequency of migraines as well. So, looking at the conclusion and the evidence grade based on the findings that we found, three conclusions can be drawn. The first conclusion is that oral magnesium supplementation of 300 milligrams daily can ultimately be utilized by individuals who suffer from migraine attacks to help with reducing migraine formation over time. Again, if those who suffer from migraines, they start incorporating 300 milligrams daily of that oral magnesium supplementation, based on the research findings of this presentation, I believe that this would help with reducing the frequency of migraine attacks as well as reducing migraine formation over time. Number two, research shows that both IV and oral magnesium can showcase beneficial effects in the reduction of symptoms associated with migraines in adults over the age of 18. And number three, oral magnesium supplementation can ultimately be utilized within the clinical setting by healthcare professionals to help treat patients with chief complaints of migraines and headaches. So number two and number three kind of tie together of knowing that oral magnesium supplementation can ultimately help with reducing the effects of the symptoms associated with migraines. This is something that clinicians and healthcare professionals can ultimately utilize in the healthcare setting when making recommendations to patients with the chief complaint of migraines. It can also be beneficial to recommend patients to go with the oral magnesium supplementation versus an IV supplementation, as this is something that's more cost effective and easier to assess and obtain on a daily basis. So I believe that these two findings can ultimately show a conclusion of how this is something that can be implemented in the healthcare setting. Based on the findings of the research, we ultimately decided to give it an evidence grade of 2 based on the grading table shown below. So, with every research, there are their strengths and limitations that can be noted. So, based on the findings of the research articles that we discussed, some strengths that I noted is that the articles showcase how magnesium serum levels are noted to be lower within individuals who suffer from migraines. So, I think this is a big strength because it really does show how different the magnesium levels are in those that have the migraine symptoms compared to those that do not have migraine symptoms, because that can be a first sign of how magnesium can play an important role in why those with migraines have those severe symptoms. It could be due to a deficiency in magnesium. Another strength that I found is the meta-analysis from various studies have been noted within these findings. So a lot of these research articles use a meta-analysis approach where they take a bunch of different research and findings and they incorporate it into one article to showcase um, the overall findings based on various published research, which I think gives more of credibility and showcases how a lot of research on this topic was done, and it ultimately does showcase how magnesium plays an important role in the reduction of migraines over time. And the third strength that I noted is that oral magnesium has shown to be beneficial within those who suffer from migraines based on the findings. So, based on different studies that were performed when individuals were giving magnesium supplementation and a placebo, or they were given oral magnesium, IV magnesium, etc., conclusions ultimately did show that the oral magnesium supplementation did help a lot with reducing the symptoms and also the occurrence of migraine formation over time. So I think these are definitely three strengths that really help validify our nutrition question and really helps to answer how oral magnesium plays a role with the migraines. And then, of course, there are limitations within this research. Like any research, there's always going to be limitations that can be found. The first limitation is that there wasn't enough findings published within recent years. A lot of these articles were unfortunately written about a decade ago. I think that newer research can be done on these findings, can build upon articles that were published a decade ago, and especially with new technology, there can really be an advance on studying the effects of oral magnesium supplementation on migraine patients. Number two, there was no specific duration of timing that was reported in these studies. Most of these studies kind of just gave an overall view of how oral magnesium supplementation plays a role, but it did not give a specific time period of when these trials were done. So I think having a specific time frame, for example, at least 1 year, would be really beneficial to show the long-term effects of taking an oral magnesium supplement. And then the last one, there was no specific dosage of oral magnesium being tested in each study. I think each study gave different ranges. For example, the first study we looked at a range of 250 milligrams of magnesium supplementation. I believe that based on the recommended dietary allowance, as we discussed in the beginning, of 400 to 420 milligrams daily for adults, I would stick to at least 300 and going up to at least 400, 420 over time. Obviously checking with a physician if that is okay based on individuals individually. And I think also just checking serum magnesium levels over time to see the range of magnesium to see if supplementation should be advanced or should be lowered. Some individuals may be taking too much magnesium, but I think focusing on one specific dosage on a study, and especially with the reported time frame, would really give a better insight on how much clinicians and healthcare professionals can recommend to their patients with taking oral magnesium to help with the migraine symptoms, as well as how long they should be taking the oral magnesium supplementation. For example, it should be a couple months, years, or if this is something they should implement lifetime for the reduction of migraines. And then some implications for research and practice that we already discussed, but I will go a little further into. Some implications for research, further investigation of how these interventions can vary within different populations globally is definitely something that can be utilized. For example, individuals within the United States versus other countries. I think seeing how implementing oral magnesium supplementation in those within the United States and maybe a different country that doesn't have the same resources healthcare wise, but is able to provide oral magnesium supplementation to the patients would be something that is really beneficial to show the differences between different populations globally and just show globally how this issue can be resolved as well. Another implication for research, you can take the concepts from previous research to build upon new research findings on how oral magnesium can be beneficial within other disorders. Again, a lot of these studies were published decades ago. I think taking the concepts of these previous research and also incorporating new technologies, new findings, can really help to validify this research question and can help showcase how oral magnesium can be more beneficial now, knowing more with, again, technology, just knowing more based on previous findings and building upon that, this can really help with expanding research opportunities. And again, implications for practice, this can aid with the utilization of oral magnesium in the clinical setting and with making clinical recommendations to patients with chief complaint of migraines. This can definitely help with avoiding having to take over-the-counter pain relievers all the time, having to take medication all the time that can have reverse effects. This can also help with cost, accessibility. It's a lot easier to go out and buy an oral magnesium supplementation on your own versus having to see the doctor, get a medication right up, go to the pharmacy, take the medication constantly. I think magnesium has a lot of different benefits for the body as well. So this is something in the healthcare field I think clinicians can start ultimately utilizing to help with their patients that suffer from migraines. And finally, this is a more cost-effective method of migraine treatment over time with the reduction of those hospitalized with migraine symptoms. I believe having those that report migraine symptoms initially and then giving them that oral magnesium supplementation can definitely help with reducing those that are hospitalized by migraine symptoms. Again, this is also something that could be built upon in the implications for research, testing how taking oral magnesium supplementation over time can show the reduction of those hospitalized for it. But I think based on the conclusions and findings we found in this presentation, this is something that definitely can help in the healthcare setting overall. These are my references for the presentation, and I want to thank you for watching this and going through this presentation with me, and I hope you enjoy the rest of your day. Thank you.